Kenya marked the World AIDS Day, and as it was doing that, the county government of Homa Bay, Department of Health, was kicking off a crackdown on those who had defaulted on their antiretroviral drugs, commonly known as ARVs. As Bernardo Juang reports, the county is now using support groups to raise awareness on the importance of ARVs and why defaulting is frowned upon.
It is now 41 years down the line since HIV/AIDS was first reported in Kenya. Efforts by the government to curb the spread of the virus have been successful in the past few years. For instance, in 2020, at least 42,000 new infections were recorded, down from the early 2000s when at least 700 people were infected daily. And even as the government and health partners continue soldiering on, moving door to door, sensitizing locals on the benefits of HIV/AIDS testing and the importance of adhering to medication, especially for those on ARVs. According to data that was released by the National Endemic Disease Control Council, NSDCC, between January and August this year, indicates that the country recorded 67,731 cases of ARV defaulters, with adults aged 25 years and above leading with 47,672 cases.
The rate of defaulter was high, above 10%, but as we speak now, is slightly below 2% of adult patient on care. This is because availability of drugs, and also because of the pragmatic support that we have. We have defaulter tracers, we have adherence counselors, we do home visits for these clans.
Homa Bay being one of the counties that has hit headlines over high numbers of infections every time a statistic is released, recorded 2,326 defaulters. Things here seems to be changing for the better, and this is due to concerted efforts by the bodies concerned.
We did an IPD study which actually confirmed high number of mortalities within the Homa Bay County Referral Teaching Hospital, notably in the IPD ward, the adult medical ward. And over 60% of those patients were actually cases of advanced HIV, and which actually contributed to 55% of mortality that were seen around that point.
To prove this, we visited Florence Ngeso at her home in Dewa. Having been diagnosed with HIV in early 2018, her story paints a grim picture of the painful struggle of acceptance that many patients have to endure to get treatment at a time when having HIV in this locality was akin to a death sentence. Her body wasted away to a point where she almost gave up.
Nilienda kama nimeisha. Hata watoto yangu walijua mama atarudi. Kwa sababu nilienda huko, hata chakula, hata nini, hata siwezi, wananibeba hivi, wananifanya hivi, watu ndio wamenitoa mbali. Sasa vile niliingizwa kwa ward, ni maji ndio nilikuwa nakula.
She already been put on ARVs at that time. Florence tried all the traditional remedies she thought could help her, and later something came to her mind and decided to separate herself from the husband, and the reason, she married.
Nilikuwa nafikiria hii dawa, hii ugonjwa, kama wewe iko na bwana pamoja ndio inamea, na kama umeacha maneno ya bwana. Mimi nilikuwa nafikiria, ujinga yangu ilikuwa iliniweka ati hiyo itakufa kwa sababu nimeacha nini bwana. Sasa hiyo ujinga ndio ilifanya mimi niache dawa. Kumbe mimi najiumiza mwenyewe.
She defaulted and her health started deteriorating. Her fellow business women could not stand her. Florence had to deal with the stigma of HIV. Though she says she didn't allow it to depress her, since deeply she knew she defaulted.
Sikia mzuri na vile watu wanawachanga dawa. Kwa mimi naweza sema hata saa hii siwezi acha.
3 types of medication.
But through concerted efforts between Homa Bay County Government Health Department in collaboration with Medicines Sans Frontiers, MSF launched a program in tracking and sensitizing the community to enhance adherence, an initiative that has contributed to the current statistic that Homa Bay County has recorded.
Sisi tulishalemewa na wenzetu wasilemewe kukunywa dawa, na tunawashauri kila mtu, tunahakikisha kila mtu asiwache kukuja kuchukua dawa au kumeza dawa ili avamiwe na virusi mingi mwilini, ili awekwe tena kwenye dawa yenye iko juu ambayo kazi yake kuipata pia sio rahisi.
Well, it is a disease that for a very long time, especially in the rural setups, has been associated with witchcraft, causing conflicts amongst family members due to accusation of bewitching each other. Maurice Ouma, one of the victims, has a well-lived experience as he narrates.
Kitambo kabisa nilikuwa naenda vizuri kwa biashara yangu. Sasa saa zingine nilikuwa naenda nyumbani. Wakati nilikuwa naenda nyumbani, mandugu zangu walikuwa wananiambia nisitumie pesa juu hapa hapa kwetu kuna uchawi sijui nini. Sasa nikasema haina shida. Sasa kidogo nikarudi kwa mahali pangu pa kazi, kidogo nikaanza kusikia kama sisikii vizuri. Sasa nilikuwa nadhani ni uchawi ama nini juu kulingana vile mandugu zangu walikuwa wananiambia. Nikaenda hivyo, baadaye nikaona hii sasa imezidi. Wacha nirudi nyumbani nione kama hao wazazi wangu wanaweza kunipeleka OC.
Anad Ojuang, NTV.